Thank you, everybody, for coming here early this morning to talk healthcare. So again, AT Gimbel here with Atlanta Ventures and the Tech Village, and we got Berkley Baker from ATDC. And I think, as JC mentioned, our big goal is Atlanta has so many great resources for HealthIT, and how do we help continue to try and pull folks in the community like yourselves together to work and make Atlanta the premier place to start and grow a HealthIT business. So today what we're going to do is a little bit different. We're trying a different model, so love your feedback. But instead of more of an interview, Berkley and I are going to go through some steps of things to think about when starting a business and resources available. So it'll be a little more, less of an interview and more of us sharing our personal experiences, some of the mistakes we've made, as well as with companies that we've worked with and seeing things they've done well or lessons learned there. And we'll go through a little bit around customer discovery, the sales process, fundraising, some Atlanta success stories. I think we don't often talk enough about some of the success stories Atlanta does have. And then close with some resources and upcoming dates that are here. So I think just to get going, I'll start on the customer discovery side. And I think if you're going to start a business, this is the first place to be. And I think one of the things that I see most often with entrepreneurs is you too quickly jump to, here's my solution, let me go try and sell, push, build my solution without truly understanding the problem that you're solving first. And so there's a great book as a resource I would encourage you to read if you haven't, called The MOM Test, M-O-M, that really just reminds you about how to do effective customer discovery. And the premise of the book is you go to your mom and say, Mom, I've got this great idea that's going to do X, Y, Z and save all this money. What do you think? And of course, Mom's going to say, that's great. And you walk away thinking, I've got a great idea. But the reality is, right, that's just kind of tricking you. And I've made these mistakes in customer discovery before where you kind of hear what you want to hear and you're focused on your solution versus starting with the problem, asking them questions. What are you working on right now? What are your challenges in doing that? How are you trying to solve that problem today? And what you're looking for is, where does that problem rank on their priority list? I've seen lots of folks try and solve problem number 47 of importance for the health system. Is it really a top 3 priority that the CEO is worried about and will get buy-in? So how big a priority is it? Another area to look is, how often does it happen? Hey, they mentioned an issue. Well, when was the last time it happened? Was it last night? Was it a month ago? Was it a year ago? And understand the frequency with which it happened. You're looking for stuff that happens at a regular frequency or is a part of their workflow. And then you go from how often does it happen, so what did you do about it? Okay, well, yeah, this happened, but it happens all the time, and we just move on and go to the next thing. Or I was up till 4 a.m. with my team trying to fix this problem, or I've created my own homegrown solution by pencil and paper or Excel to try and tackle it. And I think what you're looking for there is they're actively trying to do something to solve the problem. I've made lots of mistakes. I've seen companies make lots of mistakes trying to go after a problem that they're not already actively trying to solve. And I don't care how they're trying to solve it. It can be manual or just on the side or with a pencil and paper. But if they're not actively trying to solve it already, my experience has been much harder to convince them that they should buy a product to go solve that problem. So I think those are some of the things that, as you're going through, really start with that problem first and understand, is it must-have? Is it mission-critical? Does it happen with frequency? Are they already trying to solve it in some way? And are they frustrated with their current solutions to solve that?
Yeah, I think what I would add there is, oftentimes your background kind of informs your view. And so I went to a military college, spent some time in the Army. And this oftentimes reminds me of just some of the work by Colonel Boyd. Maybe some of you guys will know that because he was at Georgia Tech, spent some time at Tech. So
great school.
Little Tech shout out. But really he was a colonel in the Air Force, and he came up really with the OODA loop. Some of you may already be familiar with that, but really observe, orient, decide, and act. And he was talking about it really when it comes to combat aviation. There's some nice work out there by Harvard Business Review around applying that model. But when you look at it, really that first step is observe. And I think a lot of times what we find in customer discovery is that when we don't spend time really observing what our customer is doing, observing those pain points, observing their challenges, we start to orient ourselves to a solution before we've really observed what their challenge is. And so I find for me that's just always been, I mean, if we had an hour to talk, 50 minutes we could spend in customer discovery. It's just that important. It's the gift that keeps on giving. No offense to Goizueta. I mean, I went there, loved it, right? I mean, so when I finished at Goizueta, spent some time at Georgia State doing my doctoral piece. But of all the classes that I've taken, customer discovery, when I went through that at ATDC, was probably one of the most valuable things that I went through. I mean, it really forced me to spend time with my customer to get that understanding that AT is referencing. And when I say it's a gift that keeps on giving, I mean, later when we, so now, and I'm sure you've heard this and the companies that you work with, I'll hear questions at time like, how should we price this? That's a great question. What have your customers shared, right? I mean, willingness to pay is one of those things that we should be able to get a sense of in customer discovery. Where should we start? I mean, is this something where we should start in acute care or should we do long-term care? Well, that's a great question. What are your customers saying, right? Or we'll pivot into healthcare from another industry, and we've done great customer discovery in that other industry, but we really haven't done it in healthcare. And so for those reasons, I mean, just a solid attention to customer discovery is just really, really important.
Yeah, no, spot on. And I think as you look at customer discovery, right, in general, big picture is, and we'll touch on this more in the fundraising side too, is you can do a lot of this with just your time. This doesn't cost you millions of dollars to go do customer discovery. And I've made plenty of mistakes building products without doing effective discovery, and I guarantee you 80-90% of the things you build will be waste. And it costs time and money, and the more you can hone this, the better set up you'll be for the future.
Well, and to that point, I mean, it never goes away, right? So once we even sell into an institution, I mean, my background is a little bit more med device early on. So I spent about 8 years with Johnson & Johnson and about 10 years in the robotic surgery space. And I remember oftentimes going in, whether it was just straight device or doing that from a robotic surgery perspective, and just watching how the surgeon performed the procedure as is. Watching where the pauses were, watching where there were challenges in the communication, watching, where the case slowed down and where things sped up, right? And so by understanding that, when we're then having a conversation around a solution, I've really observed what they're doing. I've oriented my conversation based upon what I've seen. I've decided, okay, this is what I'm going to talk to them about, and then I act on that decision. And then I'm observing their response based upon what I've decided and acted on. And so that's where, for me, I'm just going back to that OODA a little bit, but showing how in customer discovery, it just never goes away. And if we haven't done it well, at some point, we're going to keep stumbling across that until we take the time to do it. So.
It's a great point. We used to have, I had part of LexisNexis healthcare group, there's a lot of data and analytics, and we used to go travel to visit our customers, and we would sit with them for 30 minutes and just watch how they use the tools, how they did their job. And it's amazing how much you would learn of, gosh, why are they never going to this spot? Or why do they always go this way? And sometimes it was just lack of awareness. Sometimes it was they were trying to do something that wasn't able to be done in the system. But to your point, you learn a ton through that. So let me go down to the next stage. And this is an iterative loop. To Berkley's point, this is always ongoing. And all of these steps here are always iterative. It's not just a linear flow. So the next one is the market. You probably all hear all the time about, I'm in a big, large, fast-growing market and all of those, type of things, and TAM buzzwords and this, that, and the other. And obviously, you do want to be in a perfect world in a big, large, growing market. A lot of those things do matter. But also, I think what you're trying to look for is, how do you define that market? Is there a niche within that market that you can start and win there? Because oftentimes we see you have these big markets, and there's some macro player in the market, but there's many niches underneath that. And maybe that niche is hospitals less than 20 beds, or payers of this size members, or whatever it may be. But there's often niches within a big market. And so one of the things as a startup, you don't have the resources to go come out and compete on all 100 features in a macro solution. But you can define a problem, go after a niche in the market with one mission critical feature that's not being met in that market, and start there and gain traction, and then move into a bigger and bigger market. So I think of, are you in a big market, but what is that niche that you're targeting? And the other thing I like about markets to look at is, what are the external factors that make the timing right in the market? There are lots of great products and companies I've seen that were too early, too late, and it's always hard to completely control the timing, but what are the external factors that, with the Affordable Care Act, that created a lot of openings for businesses to move forward? Or we had some products that were around checking providers who wrote prescriptions. Are they deceased? Are they sanctioned? That was driven by requirements by the government. And so what are those external factors? And maybe it's something simple like now, versus 10 years ago, now everybody has a smartphone in their pocket, which enables you to do different things than you could have. And so what are those external factors that also make the timing right to go after a certain market?
Yeah, and I know you guys are going to get maybe a little tired of some of the military examples, but it's just who I am, right? But I will share that when I think about that from a market perspective, and when you guys were talking earlier about, hey, here are some of the challenges that we're facing, that we see coming up in 2020. It just reminds me of, and the author of this escapes me, but it just reminds me of the VUCA model. And the VUCA model kind of goes through these areas where there is a lot of volatility, there's a lot of uncertainty, there's a lot of complexity, and there's a lot of ambiguity. And it really kind of works through where I see those complexities, where I can reduce the volatility, where I can make things more certain where they were before uncertain, where I can reduce the complexity. If I can make things clearer where they were previously ambiguous, I can really drive value. And a lot of times we find that that helps when I'm talking about understanding and targeting a market. When I think about that just from a robotic sense, that technology was really developed for cardiac surgery. It was developed for the area that was most complex. But if you look at just the layout and how that's used, and if you follow their revenues and this, that, and the other, you'll find that 95 to 98% of their revenue is not coming from cardiac. The area that they decided to go to from a market perspective, what helped is that technology-wise, they were built for complexity that could be used in all of these other markets, but it really didn't adopt there as well as it did in other places. And so I think that there's just this understanding when we're looking at markets is, if I do win in that market, will it allow me to scale and leverage that success into other markets? And that's what I think some folks have certainly done well when we look at folks that are now pivoting in the healthcare. In some cases, we have some startups at ATDC where they started off in financial. They started off more so leaning a little bit more towards insurance. But then based upon that success, based upon the value that they drove there, now they're pivoting into an additional market based on winning in those other areas of complexity. So.
Yep, for sure. And so, again, looking at, hey, you're defining a problem, you're looking at the market, understanding the dynamics, well, naturally sort of flows into the target customer. And one of the challenges I see that folks often do is say, well, who's your target customer? Well, we're going after all payers or all hospital systems. And while that may be true in a future state, I see much more success when you focus. And I think as you do the customer discovery, you'll get lots of feedback on all sides of the spectrum. And part of what I look for is, where are you getting consistent feedback from a defined segment? So again, it may be hospital systems less than 20 beds, where they all are zoning in on one problem, one key thing, and that's an area where you can go focus, right? And so you're testing them on the same thing. All right, is that problem consistent? Can I go after that market? Can I define them? And then in healthcare, right, you get the added challenge of, there's so many players. All right, well, how does this interface with the hospital system, with the payer, with the patient, with the pharma company, whatever it may be? And so that's an extra level of complexity that as a healthcare startup, you have to understand how to navigate. And some of those may be more or less important than others, depending on your product, but the awareness to understand that ecosystem, I think is important. But at the end of the day, as you go through this, back to what I think I'm looking for when I get to this segment is, it's a customer that's got a clearly defined problem. It's one that I can actively target. I know who the buyer is, And the best case scenario is before I've spent any money, I'm drawing it on a piece of paper. It looks like this. And they're saying, I want to buy that right now. I want to be your development partner to build that. And they are actively wanting to purchase, use, partner with you before you've even built anything, because that shows that there is true demand for that authentic demand, that latent demand, that they want something like that, and they want to work with you to build that, versus that's nice, and then you go, well, when you have XYZ, come back to me. My experience has been, when you have XYZ come back to me, when you come back, they say, well, now what about ABC? So make sure before you move on that you've got them defined, it's a clear problem, they're excited enough about what you have, and if they're not, that's okay. Why? Why not? What else are you looking for? And try and tweak that before you move on.
Yeah, I mean, I think that's spot on. I mean, you know, for me, it's interesting how I think that this target customer really kind of overlays a little bit with the technology adoption curve, right? When we think about that, and we think about, you know, going from a technologist or an innovator, then early adopter, you know, then we have, you know, early majority, late majority, laggards. But those segments are behavioral, right? So I've had folks that will say that they're innovators, but then they'll ask the question, who else is using it? You know, how many other places are you know, how many other customers are already there? Those aren't innovator questions, you know? Those are like early majority, late majority questions, right? And so to your point, I mean, I think that back of the napkin, if I have someone that wants to kind of get in the trenches with us and develop, when you talk about target customer, early on, those are the customers that we need, right? We need customers that are willing to take chances and iterate with us, that want to give that feedback, especially early on. And so I think that, you know, a lot of times we can find ourselves with more of a broad approach, and I'd rather just have one or two customers that are on that innovator, early adopter side than 10 that are like, you know, late majority when I'm just getting started, because it'll just drain you. So.
Yeah, no, spot on. I'll tell you a quick story. So mentioned worked with some data analytics products in healthcare, and so we had one targeting fraud, waste, and abuse in healthcare. So it's a big problem. 10% of all claims are fraud, waste, and abuse. So that's a pretty big number when you think about it. And there's requirements for healthcare payers to have a fraud, waste, and abuse system. Well, as we're starting into discovery, what we found is most of them are just check the box, that they have a system. It's not a CEO top 3 priority. But then as you start to peel back, the way they go about it today was, for AT, the fraudster, does something. They figure out after the fact what the scheme was, and then they put in some rules or analytics into their system to stop it. And then AT, the fraudster, goes and does something else. And then they move and figure it out and then go put those rules. And so the fraudster is always ahead. And so we had the premise, working with some of the customers, how do you, instead of focusing on what they're doing, focus on the who, focus on AT, and stopping AT before he's doing those next things. And no, I'm not a fraudster. But that was something as we were going through, and it resonated with some customers, it didn't with others, but what we found was there were a couple of the early customers that were like, that is exactly the way we need to go. Before we built anything, we want to be a development partner with you. And so we had 2 customers that went and built this product together with us before it was even ready, committed to paying for it up front, and it was invaluable, the amount of feedback they had in the development process of, this is how we use it, this is how we would use it. Wait, this is good enough. Don't even build these other 3 things. We're ready to start using it and go live now. Or here's how I would think about the value proposition to us. And that transparency you get from building and iterating, you learn so much more than just I'm building in the lab by myself and say, here it is.
I mean, I think that's when, was there a question?
Could you talk a little bit towards the tension or the balance between having the value of your target customer and finding the right price point, especially in a startup where you're needing a premium price point to cover the investment you've made, and just how you've seen companies navigate that?
Yeah, good question. I would say for a startup, I worry way more about the value than the price point. Price points are easy to change, and in the long run, if you have value, you'll be able to settle into a price point. Early on, I think, you know, my experience is getting customers who see the value in using the product. That learning you get when you first start is invaluable. And again, to this point of doing discovery without spending millions of dollars to go build something, I can get a lot of that feedback around the value and convince myself and have my customers be convinced that, yeah, there is value there and I would pay $10,000, $100,000 for this product. Or if they don't, but you can always change the price point easily, but big businesses are built by creating value. And so I would focus on the value first.
Yeah, I mean, and to reinforce that, about, I think it was like a couple weeks ago, we had this gentleman, John Hargrove, come into ATDC. And he spent about 30 years with Johnson & Johnson. He was a CEO of a startup robotic surgery company. And he said, you know what, value doesn't cost, value pays. And I was like, John, first time I say that, I'll give you credit. But after that, I'm just going to, act like I pulled that out. But, I mean, I really, to your point, is that I think that as we are building that value together in a collaborative fashion with the customer, it helps us to get an understanding of those price points. I think sometimes, when we're trying to collect information, we're trying to do customer discovery, sometimes we're a little bit sensitive about having conversations around price, and I think that may be appropriate earlier on. But as we kind of work through that scenario and as we're kind of continuing to collaborate, at some point that willingness to pay is certainly, I think, an appropriate conversation. So does that help?
And I think, too, as a general rule, seeing lots of startups, majority of startups underprice because they're not confident in the value they're delivering. And so just as a general statement, more often than not, I see startups underpriced. But I think your question leads to the last one, which is, you've got all this great stuff. You got a problem, you're in a market you like, you've got a defined niche or target customer. Last thing I like to do is just do a quick pro forma of what is the business model like. And I'm not looking for projecting for 5 years to the dollar how much EBITDA I'm gonna have, because the one thing I've learned about every financial forecast is they're wrong. But what's more important is, what are the parameters of what does best case look like? What does worst case look like? What type of gross margin am I gonna make from this? Is this a 90% gross margin business that would scale phenomenally? Or does this have tons of implementation and other stuff that I'm, even in a best case, only making 30% gross margin? How do I have to sell this? What does that model look like to scale, to get to the target customers? Does this make sense if I go? And at a simple level, I'm looking for things like basic math. I'm charging $10 a month for this product and it costs me $20. If that's all that the market would bear that's not gonna happen. Or, yeah, I passed the initial sniff test and can move forward. You're looking for the big red flags, the big watch outs that says, if I do go after this, I believe there's something there. With the caveat that, again, things will change, right? Just because somebody's gonna do X today doesn't mean in the future your costs can't come down or the value couldn't change. But at least have that initial, I call it the red flag test. Best case, worst case, what could go wrong, and am I comfortable in those scenarios? Because if you're comfortable with the best case and you're comfortable with the worst case, everything in between you can figure out.
And I think sometimes with the business model, like there's B to C, there's B to B, but then there's B to H. It's like a whole different thing, right? I mean, it's like the characters we probably use are probably even different. I mean, and so sometimes we'll go to, we'll shift into healthcare and we want to use the same models that we were using outside of healthcare within healthcare. And sometimes you'll find that those models may work if I have customers, like if I'm shifting into healthcare and I'm selling to payers. Well, that model is a little bit closer to B2B. I mean, they're at their core, it's almost like they are that B2B fits. But if I'm now selling into hospitals, right? I mean, 98% of all hospital purchases are through GPOs. Some of us may be in here like, what's a GPO, right? And so there's a different model that we find that as we're diving into healthcare. So we want to make sure, and one thing that I see at times, I mean, we have like 60 to 70 companies that are in the healthcare incubator at ATDC, and you'll find at times, sometimes the model is geared more towards investors than they are really to the customer, right? So we know that, hey, the investor community here loves SaaS, right? And so then we're like, okay, now I'm gonna force fit that, but that doesn't really work for a medical device per se, for some particular procedure. And so I would say I understand that. We want to, certainly understand those sensitivities, but we want to make sure that the model first and foremost really fits the customer. Because if it fits the customer, we'll get the results that drive the investment. And so that's just one of the things that sometimes I observe over there.
At the end of the day, if you deliver value for your customers, you can build a big business. Let's maybe transition next. Oh, pause there. Any other questions on customer discovery before we move on? All right. Sorry. Yep. Go there, and then I'll go here.
So you're talking about target customers and partners. As a startup, you're learning continuously, right? So what are your thoughts on the double-edged sword of having a really big customer being interested in you early, and you're still learning, so you're going to fail, and they're used to having enterprise providers, right? So what are your thoughts on the balancing learning with new customers versus getting a big customer, and that learning can be very expensive if you mess up a big customer?
Yeah, great question. And it's always a tough problem to have, right? Hey, big, large company X that's going to spend $1 million, but then they come in and they move slow. They ask for all this custom stuff that you don't think is applicable to all your other customers. How do you balance that? Very, very real. That's one of the lenses that I usually look at for those big ones is I'm a big believer in, back to the point, start with those development partners that truly believe in it before you're building anything. And they may be big, they may be not. Oftentimes the bigger ones aren't the right fit, but not to say all of them, right? It's more about the behavioral side, as Berkley was saying, right? That they truly are committed to doing it. They've got a separate group. They can make their own decisions, right? And you're testing it there, but I always give folks the watch out. If you are going to go with a large customer first, what have you learned in that customer discovery feedback before you commit to them? And then start to have that filter and that discussion with them, right? That says, look, I'm not building anything customized. I like configurable versus customized. Configurable means I set it up one way and I can tweak it. Customized means it's just for that one big customer and it's no reuse later on. And that's a lens I always try and look for with a big customer, because they oftentimes push for more customization. And I've seen companies get astray, that they get excited by this big customer and then it just sinks them because they're doing all this custom stuff, and before they know it, they're in too deep and it's tough to get out.
Yeah, I lean hard on the behaviors. I mean, I've just found a lot of times, folks will say, hey, I'm ready to go, I want to do it. And then they're not moving and we're not getting any action. And so I'm always kind of looking, I get what you're saying, but let me check out the behaviors. And so sometimes you can have that big organization that really, they act small, meaning that they iterate and they'll pivot and they're excited to kind of give feedback, and you're not pressing to get a meeting. They're always available. Here's my cell phone. Yeah, let's talk about it. And on the other side, I can have sometimes small companies that then want to act big. Like, hey, I don't have time for that. We'll get to it later. Meet in 3 weeks. So I'm really looking at the behaviors relative to being an innovator. And one of the things that I learned, I guess when we talk about mistakes that we've made, I think there were times in the healthcare community where I had some assumptions regarding which facilities or which hospitals or which systems were innovative and which ones were not. And what I've found is that can really pivot based upon where they are strategically, based upon what's important to them. So even here, if I think about Atlanta, without naming any particular facilities, but there's some when I look at prenatal care, mom and baby, labor and delivery, where that's their model, that's who they are. So when it comes to innovation in that space, they lean a little bit further forward. But then there's other institutions where that's not what they do it, but it's not their focus, it's not their core. Their core may be cardiovascular. And so now if I have a cardiovascular solution, I'm going to probably see more innovative behavior from them there in cardiovascular solutions as opposed to labor and delivery. And so it's really that alignment with who they are and what I'm observing. Who are they really pushing who they are to the public, and kind of aligning with that. And then I find that whether they're big or small, they tend to be a good fit for what I'm trying to do.
Question here? So I would actually disagree with the first part you said. I don't think early adopters.
I don't do free.
I agree. I don't do free because there's no incentive for them to get the feedback. If they're not committed to pay something for the pilot, they're not committed. They're not the right person to be in development with.
Well, and I think the other thing that's important for it to be a partnership and collaborative. So when we have industry that you know come into the building, one of the things that we'll share is that you know some of the things that we find that are very important to entrepreneurs is really so there's money, access, and pace. And so for them to do a free pilot as an entrepreneur, you know, I mean, there's no cash flows. It doesn't help. So we're looking for collaborative partners. We're looking for paid pilots. And so it may be reduced cost, but even there, it's really related to the value. I mean, I had a large GPO once tell us that when they're working with startups, they're looking at for every $20, you know, they're looking for a $20 saving on a dollar spent. And that's typically what we see, but it's not necessarily free. It's that they are just looking at, we are really getting some value out of this, but we're willing to pay for that value.
And I think to that point, I worry less about the actual price point of the pilot and more the fact that it is paid. Whether it's $10, $100, $1,000, I care less. It's the point of once there's some money greater than zero, they have to go through hoops on their side and make commitments on their side that are different than just free. And so it's okay to be discounted from what you would normally do for that feedback, but I'm a big believer in making them pay something, or they're not truly committed to be a development partner.
And one other point to add there is that because sometimes after, we've seen with quite a few startups, that after you go through a period of free, and then it's like, okay, that worked, great, now let's pay, then it's disrupted. And so that's why it's so important to already have that kind of ongoing.
Not necessarily get paid enough to pay for the product.
Correct.
That's why I misunderstood.
Yeah.
I didn't agree, but they want it cheap because they're early.
Yeah, and again, you're choosing the part that you care more about the learnings and the feedback than the actual price point. And so you want to make it in a way that's beneficial to both.
To me, it depends on how early. If it's so early that they're not really getting value out of that and we're trying to really figure out value, then I get that. But if it's a place where value is pretty clear and we're delivering on that value, I mean, I think it's appropriate to actually have a shared revenue model to have a piece of that value.
I mean, and depending on the complexity of implementation, because depending on your product, right, there may be large implementation or other things to do. Another trick I've seen is you sign the contract, and it's got a 30 or 60 day out, and they're never going to go through the process of getting out of the contract. But at least it justifies in their mind if they don't like it, they can get out, even though they're not going to actually do it, and then you get paid. Sorry, in the back, and then we'll go up front here.
A lot of it too may go not just to pay for the product, but also they're going to be putting time and effort into this product. So they have to commit manpower that normally they would charge for. So if they're willing to do that at no cost to the startup, that helps out as well and puts the commitment.
Absolutely, yeah. That feedback you get from them, I think, is the most important thing, and that engagement. You're looking for that engagement, that they're looking forward to taking your calls. They're actively participating in the meetings. It shows they're really trying to solve the problem versus if you feel like you're trying to pull teeth to get them to show up for things and answer calls, it's probably not a must-have that you're bringing.
And if I'm in any way unclear about that, what I'll do is just draw out the value chain. You know, and if I look at the value chain and all the things that need to happen, and I find that, let's say there's 10 steps in the value chain, and they're all equally weighted. If they're doing 7 out of the 10 things, well then, you know, that's going to impact the price. If I find that really they're only doing 2 out of those 10 things, then hey, you know, I'm delivering more value, and so I'll use that to just get some clarity around it, and it's a good way to talk through it.
Tom, question?
Yeah, one other factor, and so it's not always appropriate, but it's a factor I call competitive tension. If you can create competitive tension so that the other side is not going to have to go to their boss and say, my competitor actually got this technology rather than us doing a deal on it and so on. So difficult with early stage companies, but I found that to be one of the biggest motivators if you can create, and doing it subtly, so it's not blatant.
Yeah, no, absolutely. That's another good trick. Some quick time check. Obviously, we could talk customer discovery all day long. I think it's the most important one. So I'm open to continuing questions here, or we can move on. If there's any other questions, stay in customer discovery. Anybody? All right, well, let's quickly move on. Sales process. Maybe just rather going for the full scope. Obviously, I think everybody knows healthcare sales processes are much longer, much different than a B2B SaaS company signing up on the website and going live right away. But maybe Berkley, maybe just some tips and tricks of things you've learned, being in sales and in healthcare to help startups think about in the sales process.
Sure, yeah. I mean, I think for me, one of my biggest lessons learned is that when I was with J&J, I think the most expensive thing that we sold was about $10,000. And there were times where hospitals would say, hey, listen, we need a budget for that. We'll put that in next year's budget after it goes to a value add committee or this, that, and the other. And then I started in the robotic surgery space, and so anywhere between 1.7 to 2.25 million. And sometimes we close those things in 90 days. And I was just like, oh, I think a lot of times the sales process, healthcare tends to be longer, right? There's complexities to it. We'll talk about that a little bit. But I would say sometimes it becomes longer because it's self-fulfilling, because we kind of expect it to be longer. And so one of the ways that, when I just look at the differences of those experiences and just to touch a little bit on why, I talk about that behavioral aspect. So when I went back to Georgia State, my dissertation was around this challenging fact. So I had a lot of hospitals that talked about value-based, or added value really being the emphasis of why they're purchasing. They wanted things that were going to reduce costs and add clinical value. And so I was looking across the space, and I was just remembering, robotically, when it first started, there weren't clinical, really, white papers out there demonstrating a clinical advantage of robotic surgery. It wasn't present. Financially, we knew we were going to be adding a cost to every case. Operationally, we knew that we were going to be making the procedure slower. So from a value-add perspective, it was like, okay, what's going on here? And specifically, there was a specific procedure for me that really brought that home. It was laparoscopic cholecystectomy, which is just the removal of the gallbladder. And that was a case that was primarily already done minimally invasively. So here it is, 98% minimally invasive, more costs, slowing things down. Why are we doing it? And the first 18 months, hospitals spent $65 million to be able to do that procedure robotically. And so you hear me when I say, hey, I look at behaviors and not just listen to what folks are saying, because what they're saying, you would never expect them to actually do that. And so I think for me, a model that's really kind of helped me kind of walk through sales, this is less tactical. There's a lot of good stuff out there, strategic selling, integrity selling, all that, and I'd be glad to share that stuff with you guys. But specifically to healthcare, for me, it's kind of, I go through, it's like a CFOS model. So it was really kind of what my dissertation kind of walked through. And there's 5 pieces. There's clinical, financial, operational, strategic, and social. And so clinical, I kind of walk through this, just kind of going through the hand. Clinical, just like the thumb, it touches everything else, right? If I can reduce blood loss, which is a clinical benefit, I can reduce costs, I can reduce operational time. You can actually strategically position yourself in front of communities, saying you're less likely to have a blood transfusion, which for some medical communities is extremely important. And then even socially, that impact that I'm driving, I'm getting people back to their communities faster. So it's really kind of the lead. So I'm always looking at, okay, so where is this clinically? It's very important when I'm selling into healthcare to be able to start and manage that clinical story, right? That conversation around the patient that was having this experience, and this is how painful it was, and because we did this, they're less likely to have that, walking through that clinical story. The second one is financial, right? It's the index finger. Even though clinical is first, a lot of times we're number one, right? Financial can kind of lead on that. As the index finger, it's directional. So in many cases, if it's going to add cost and no value, they're like, get it away from me. If it's actually going to add cost, they're like, hey, add value, they're like, bring it here, right? And so financial is just very important. Oftentimes, you'll hear facilities say that, hey, clinical is where we go first. But when you really look at what's going on, you'll find that the financial piece is really driving the behavior, right? The third one, the middle finger, is really operational, right? And so being that middle finger, it provides balance. It's right in the middle of the hand there. The other thing, though, about operational, just like the middle finger, if I lead and only talk about that, it can be offensive. If I just talk about how I'm going to help you to prevent waste, if I'm going to help you to save time, what I'm saying inherently is that right now you're wasteful and you're wasting time. So I at least want to combine that with something else, right? I want to put it with a financial piece, and so it conveys a different message. People will receive that. The other thing that's important about that operational piece is that it speaks to sustainability. So a lot of times people will implement a pilot based on clinical and financial, but if I don't get operational right, it will just be a 3 to 6 month pilot. They will not continue. So that operational piece is huge for that. They're looking to see, is it disrupting other processes that we currently have going on within the institution? The fourth one is actually strategic, right? It's the ring finger. It's where we're ready to make a long-term commitment, right? I mean, Tom alluded to some of the things around that. Really, that piece of competitiveness really touches on that strategic side. I remember, I won't name which company I was working with, but there would be times where we may go into a community and say, you know what, we're going to sell one widget in this community, and there's only 2 hospitals. And it really doesn't matter which one we sell it to. At the end of the day, though, we do believe that patients should have access to this technology because of the clinical benefits. And that strategic piece of wanting to be first, supporting their brand, supporting the image as an innovator, were reasons that they said, hey, you know what? We want to go ahead and move forward. And so if I can align with what they're trying to do long term, you can find that I can get into a longer term commitment. Strategic is very important. And then the last component I would share really is social. And social, it's kind of like the pinky finger. It's cute, pinky promise, Austin Powers. It's kind of cute and it's light. And a lot of times that's how we hold those social benefits. But what you'll find is that if I try to do push-ups without my pinky finger, if I try to do pull-ups without my index finger, 50% of my hand strength comes from my index finger, right? And so what you'll find is that if I can actually support what I'm doing from a social impact perspective, if I can speak to what I'm doing as far as reducing disparities in healthcare, if I can speak to what I'm doing as far as improving access to between providers and patients, if I can touch on some of those social concerns, it actually will expedite what we're doing from an adoption perspective. And so we found that when I was working robotically, is oftentimes patient advocacy groups, right, are great ways not to. And I wouldn't say thinking about that as far as selling the product. It's patient advocacy groups in the fact that they're people that are suffering from the disease states that oftentimes that we're treating or we're impacting. And so the patient advocacy groups, one, they touch that social concern and they will help to kind of expedite, our adoption. But it also really kind of keeps us close to the patient, which at the end of the day, if I can improve that value proposition for the patient, then I'll find that the hospital or the healthcare provider is just more open to kind of moving forward with that. And then the last thing I share there, I'm sorry, I saw you moving to it. Last thing before I forget, I'm getting old, is that each one of those actually has different customers. So there's customers that lean more towards the clinical benefits. CMOs, CNOs, they lean that way. There's customers that lean more operationally. Sometimes vice presidents of surgical services, chief operating officers. There's roles that are leaning more financially, CFO. Another one on the operational side, especially being in a healthcare IT kind of a discussion, is CIOs. CIOs are huge on that operational side. Is it going to disrupt or put at risk things that we currently are doing from a process perspective? Strategy, everyone tends to be in the room, right? Social, a little bit more patient engagement. So keeping that in mind as you're going through, I adjust my messaging based upon the person that I'm having the conversation with.
Great. No, I love the 5-finger approach. I'll remember that. So a lot of great conversation and questions this morning. I think we're out of time. We didn't even get to some of our fundraising or other topics, which is okay. We'll put it back up for another date. One thing I did want to do real quick is just highlight again, just real quickly, there are great Atlanta success stories. ShareCare is a company out of Atlanta that's raised hundreds of millions of dollars. You got a company called Cotivity that sold, HealthIT company based in Sandy Springs. In June of 2018, they sold for $5 billion. Most people in Atlanta have never even heard of that. You've got ones like Greg Benoit from Qgenda or Bird Blitz from Patient Co. that spoke last year here. They're successful companies, raised money, built in Atlanta, and growing. So there are a lot of good Atlanta success stories, and hopefully some of you will help continue to make more of those. Last two things just to wrap up. One is there are lots of resources, and Berkley and I are happy to talk, and we'll share this on the site, and there's probably many more that I didn't even fit on here. But there are lots of great resources. If you're looking to start a business, get connected with some of these organizations or groups that may be able to help you. We'll post this on the Meetup page for everybody. And then lastly, some upcoming dates. There's a lot on here, but if any of these are helpful to you, I know Chris, you can talk to Chris afterwards for the TAG Health Day at the Capitol. Our next meetup will be here March 18th. I think, Berkley, you got something coming up in February?
Yeah, on the 11th of February, Cedars-Sinai is coming in with their incubator. So we'll get a Eventbrite out, and then, yeah, that's it.
Well, great. Any last questions? We'll be here afterwards to answer anything else, but any last questions for the group? All right, thanks everybody for coming. Have a great day.